Long COVID, also known as post-COVID-19 syndrome, post-acute sequelae of COVID-19, chronic COVID-19 syndrome, and long-haul COVID, is a condition characterized by the long-term effects appearing or persisting after the typical convalescent period of the COVID-19 virus. And in light of this, the Ministry of Health is mulling the establishment of a long COVID unit to help patients with their recovery. Minister of Health Dr. Frank Anthony explained that there are cases where the virus invades the neurons in the brain, leading to other severe long-term effects. He explained too that many of the patients who have been cleared of COVID-19 end up having cardiac problems.
What is called now a long COVID unit, which would be multidisciplinary because the effects of COVID, it affects almost every system in your body. And you started with mental health, and there are cases where the virus itself would invade the neurons in your brain and can cause prolonged problems for persons. So they can have different signs, hallucinations, all kinds of different things. And they would need this type of assistance going forward.
With the unit in place, persons will be able to get the necessary care needed to assist with their recovery, the health minister said.
We have seen patients here, they'll be cleared of COVID, but then they end up having cardiac problems. Some patients who never had diabetes, when you clear them from COVID, they now start presenting with signs and symptoms of diabetes. There are patients who would have kidney problems, patients who would have problems with their GI tract. So almost any system you can think about in the human body can be affected by COVID. And if people are presenting with these symptoms after having been cleared of active infection, then we need to follow them up and to make sure that we can guide them through and help them.
Long COVID can affect nearly every organ system with sequelae, including respiratory system disorders, nervous system and neurocognitive disorders, mental health disorders, metabolic disorders, cardiovascular disorders, and so much more. Reporting for the newsroom, I am Shikima Day.